So if you look at most air quality measurements, it's 2.2 miles, 5 kilometer gridded data. And so that's not very granular data, and it's not very personal, right? It's a public health approach. It's a distributed model where they tell you what the severity of the exposure is, but they don't tell you the intersection of your physiological response to those exposures, right? There's no connection from a health perspective. So I was really interested in that particular area when I started that. So I began to develop DailyBreath. And in the process of developing that, my passion comes from this particular story. And this was prior to launching my first MVP in 2017. There was a young girl in Iowa who was on travel with her family.
Welcome to Sustainability Transformations podcast, where we discuss bold ideas to drive positive change for people, the community, and business. And today's guest is visionary, health-driven, data-smart, purposeful, a systems thinker. Kloss is the founder and CEO of DailyBreath, a digital health platform empowering people to understand how air quality and environmental exposures are shaping our health, one symptom at a time. And the key goal of our discussion is to connect health, sustainability, and innovation, but ultimately the air we breathe, why environmental health is the missing piece in climate action. Welcome, Eric. What inspired you to launch DailyBreath, and how did your personal journey shape the platform's mission?
Sure. So thank you very much, Enoch, for letting me join Sustainability Transformation. I really appreciate this opportunity. So DailyBreath started out with the idea that environmental determinants of health have really been neglected by the medical community. And that kind of was driven by an inspirational moment. My sister has rheumatoid arthritis, and she was living with my family at the time. And she came down one morning with kind of, sometimes when you have a flare up with rheumatoid arthritis, your hands are kind of rigid because, your joints are just, stiff, right? And so she kind of said, Eric, it'd be interesting if there was a mobile app that told you when the weather was changing, like the barometric pressure was changing or things like that, which are impacts on rheumatoid arthritis. So at the time, it just kind of struck me as, weather and environmental determinants of health. I wonder how those play into health, right? And so kind of when I started to look into that, you will look at metrics that say, maybe 10 to 15% of, our health is determined by the environment, our environment, right? And so you start looking at that and going, okay, well, what health conditions are most impacted by the environment? So you can go down that list and you start looking at respiratory health. Well, clearly respiratory health is the one that's most impacted by air pollution. In the case of people who have allergies and allergic asthma or allergies and a respiratory condition, they may have symptoms that are literally prompted by or by a response to that particular environmental exposure. So, that's one area, respiratory health, cardiovascular, migraines and headaches, are often caused by the weather, arthritis and joint pain. If your grandmother has a sore knee, it might be because of the weather, right? So, that was what really initially prompted my interest in it. I decided to focus on respiratory health, and this was, literally 2017, 2018 when I started developing MVPs, prototypes for integrating weather and environmental data, and then trying to create a symptom tracker that would connect for the user, for the patient, essentially, that correlation. What types of variables are those conditions that are causing me to have symptoms, right? Because the one thing I noticed as I did that exploration was most of the data that was being generated was not necessarily very granular. So if you look at most air quality measurements, it's 2.2 miles, 5 kilometer gridded data. And so that's not very granular data, and it's not very personal, right? It's a public health approach. It's a distributed model where they tell you what the severity of the exposure is, but they don't tell you the intersection of your physiological response to those exposures, right? There's no connection from a health perspective. So I was really interested in that particular area when I started that. So I began to develop DailyBreath. And in the process of developing that, my passion comes from this particular story. And this was prior to launching my first MVP in 2017. There was a young girl in Iowa who was on travel with her family. I think they went to Nebraska for a 4th of July weekend. And she had spent the day at an amusement park, and then that evening went to a hotel with the family, went into a chlorine pool, a pool with a lot of chlorine in a hotel, which is not surprising, and had an asthma attack, was down for about 20 minutes. But the story itself was not the issue. The issue was the article I read said doctors trying to pinpoint triggers for 15-year-old girl in the ICU. Well, she had been down for about 15 to 20 minutes, not breathing. So that's a severe episode. And she ended up being a paraplegic. And tragically, I learned in December of 2024 that she died. So here's a 15-year-old who died by the age of 23 because she had had what I describe as potentially preventable asthma attacks, right? They're potentially preventable. If people know more, they can do more, they can take preventative action, they can prevent these attacks. And so that really just was what's inspired for me, this concept of pinpointing triggers. And so you'll see within the Daily Breath mobile app, there's maps that actually track where people are having their symptoms, and that's kind of pinpoint. So there's a pin for where you're having your asthma attack. So that gives you a risk variable of where in your community you're having an asthma attack, but then also starting to connect the what. And I have developed a model where I call it personalizing public health. We want to actually provide you risk information based on your experience of symptoms in relation to those various environmental factors. So the app tracks in the background your symptoms and those environmental conditions. And over time, the idea is to apply AI or machine learning to that back-end data so that you can create your own personalized risk index over time. So that's kind of the background for it. In the interim, climate change is obviously a massive driver, and the visibility of the topic, the impacts of pollution on our health, have accelerated immensely, both because of the climate change issue as well as COVID, raising the visibility of, well, wow, the air you breathe indoors, is this concoction of things, whether it's a virus that's being passed or whether it's pollutants in the air or allergens in your home. So I think those two issues have really accelerated the discussion and made, the opportunity even greater for Daily Breath.
Yeah, that's amazing. Perhaps before we go into the opportunities, why has environmental health risk, especially from the air quality discussions, been so overlooked by both medicine and tech?
Yeah, so the interesting thing is on the medicine side, I can't really explain that. I think it's very surprising. I think what we're seeing now is the emergence of things like functional medicine and areas where people are realizing that there's a whole host of things that cause sickness and cause severe symptoms associated with sickness, right? You can see that we have had a sick care system for years, and our system is wired to investigate that sickness and create medication treatment, right? And so you have the whole paradigm between, the hospital treatment and the pharma and the medications kind of driving our system. It's called sick care codes. Our whole system, at least in the United States, is driven on what's the code that I can use to get payment for administering treatment for this particular condition, right? So those things are kind of how the alignment is. There's not a lot of mechanisms within our current healthcare system that incent people to focus on preventative health, right? To avoid either people contracting a particular condition or getting a particular condition, or more importantly, having specific symptoms that are associated with conditions that, when not arrested, cause serious outcomes like ER visits or inpatient hospital stays or even death, right? And so that's been the real challenge, is how do you reorient an entire system, reorient maybe the focus on a hospital-based system and a medication-based system into, let's prevent people from going to hospitals. Let's prevent people from requiring medications to address certain issues. Because part of the biggest thing that I discovered as I ventured into areas like asthma and allergies and COPD and some of these things is, even in the case of treatment, 50% of people who are required to take controller medications, which is a daily use inhaler, they don't take it. So only 50% adherence to taking a daily regimen that's really required if you have asthma or COPD. And then there's a large percent of people who may use the medications, but don't use the inhaler properly. So they're not getting that medication into the lungs. So there's many, many gaps in care, even in the paradigm around treating that particular sickness. But the real orientation is the system itself and the stakeholders, the medical stakeholders in it are not really focused on preventative health and wellness. And that's where I think we are trying to, I call it track, learn, know, and act because it's personal. It's about the air you breathe and your health, right? So track your symptoms, learn your triggers, know when those triggers may impact your health, and then take action to prevent those impacts, right? So that's one of the biggest thing. I can't remember what your second question is. Oh, technology. So on the technology side, again, it goes back to some of the available metrics. So when I started this process, the data that was available was government-based. It was EPA air quality. It's called Air Now is their data program. And they had very few sensors across the United States. And then they extrapolated that data down to a 5-kilometer gridded level. And again, that's not very granular. It's not based on a high level of ground level measurement. And then pollen's even another story. There's a very antiquated way that they detect pollen. It's, kind of flypaper that catches the allergen spores, and then someone physically has to observe them, identify what type of allergen it is, and all this other kind of stuff. So you don't have granular data, and you don't have specific data. Like people think they're allergic to trees in general, but they're actually often allergic to a specific type of tree. You may be allergic to an oak tree, but you're not allergic to hickory, right? Or whatever. So that's one of the bigger deficits. Now, you probably have seen there's been a proliferation of satellite observational data for air quality. There's been a proliferation of ground level measurement companies that are doing more fixed sensor networks across the world, or they're even mobile networks. There's a company that they put their air quality sensor on top of cars or vehicles and that measure air quality or measure pollution. And then the most recent thing is some wearables that are coming out, and that's kind of a keychain, or some people are working on like a necklace or a bracelet or something like that tracks things like PM 2.5 and ozone and CO2 and some of those variables. So that's been another area where, a lot of my colleagues and friends that I've talked to, I try to explain that we're really still in the second inning of a 9-inning baseball game. We're very early stage in this whole environmental health area as it addresses health. And, for my part, I feel like I was probably 10 years ahead of my time, right? Now things are really, really just starting to generate a lot of activity and interest because I have a platform in place. Things that I'm looking at now are how can I connect to the wearables that are out there, right? Because those wearables are nice. They're tracking the air quality measurements, but they're apps that they create that are linked to their device just track the air quality. They don't have that symptom tracker, right? And so what I'm trying to do is say, okay, well, what I'm really trying to do is connect the symptom with the most granular data. So if I'm trying to provide a personalized health model for this, the best way I can do that is by actually connecting to these wearables that are becoming available. And then when you look at that air quality measurement, that's not a 5-kilometer gridded data measurement. That's a data of the PM 2.5 particulates that you're breathing in around your body, right? And so that is, I think, very powerful information for making that correlation. And more importantly, my argument is that if you know those metrics and you know that they have an impact on your personal symptoms, you're much more inclined to take those preventative action steps. If that's an air purifier in your home, if that's wearing a mask on a particular day, there's even some things that have been coming out in the market about wearable air purifiers. A company called Respiray has this thing that, you wear around your neck. Now, ironically, this is an air purifier, a wearable air purifier. It has a very low sounding fan that brings the particulates into this before they get to your nose and everything else. And that's first generation technology, but it's aimed at addressing this particular issue is how can I call it clean or clear the air we breathe, right? There's a perception that this is a big global problem. And yes, it is. But Policy alone is not going to solve the problem. And at a personal level, you can't afford to wait for policy to make the change. You have to figure out what are the interventions you have to take on a daily basis to prevent bad outcomes that may occur to you.
From a user's perspective, how does it work? And I know you've touched on some of it, but how does it work from a user's perspective? Yeah.
Sure. So it's a digital health app. So it's available on Google Play or the Apple App Store. You can go to www.dailybreath.com and then they'll have some links for you to download the app or, again, find them in the stores. Once you've downloaded it, it has immediate functionality. You can see your daily breath forecast. So what that forecast is it's pulling based on your geolocation data. Right now that's the data I described, which is 5-kilometer gridded data for things like PM 2.5 and ozone and pollen thresholds. And then it has other weather variables. The thing that was very interesting about so I had a team do some climate research as they were investigating this, and they correlated some of this weather variables with asthma incidences like ER visits in a particular city and that kind of thing. And what we ended up doing for the forecast was creating an algorithm. And to give you an example, what we determined in our research was that on days when temperatures were above 80 degrees and the humidity was above 50%, pollutants in the air had a greater impact on asthma patients, right? And so we created this daily breath risk index to actually make that correlation and say, okay, well, if the air quality says it's this bad, let's increment that by +1 because we know it's an 80-degree temperature day and it's 50% humidity. And then there's two things on the bottom that one's an impact summary and one's your recommendations. So the impact summary tries to explain that correlation, right? So what I learned as I was doing this research and drew upon the research this team had done was because it's warmer and hotter, particulates tend to adhere more closely. So that's more dense. The pollutants are more dense, which when you think about it, then those pollutants are more easily inhalable into your mouth and into your airways. And therefore, that's why it's more problematic for you if you have asthma, right? So, that's what that impact summary tries to describe is why it would have greater impact if a particular temperature threshold or something like that is different. The other thing is that recommendations, right? So if that's the case, well, then what should I do that day? Well, maybe I should wear a mask, right? And that's kind of the things that are on the right are more or less like, okay, based on some of these variables, what are the recommendations? Well, if the hottest time of the day is at 2 to 5 p.m. in the afternoon, then maybe do a lot of your activities outside in the morning, right? So those kinds of recommendations. So that's what the app does initially is present you a daily breath forecast. You have an opportunity to click the symptom button and record your symptoms. And again, in the background, that's kind of making that correlation. And then there's both a symptom map for yourself and then a community flare-up map, which is something that I think is another dynamic opportunity with our technologies, right? With geolocation, I call it crowdsourcing for the public good, right? And if you have a community symptoms map and you're recording not just the individual's location so they can benefit from an understanding of risk, but you can see a community flare-up map to see where lots of people are having symptoms, then those areas might be where there's large pollutants, number of pollutants, or those areas might be, if there are allergy symptoms that are being recorded, that may be an area where there's a tree line of trees that are potentially allergenic for you. And so I think that that's an interesting thing because that could be a proxy. Sometimes if you get enough symptoms, you could be looking at particular areas in a community where you go, wait a second, lots of people, and I've seen this in the data and in the maps, a lot of people are experiencing symptoms in highway corridors, right? Well, that's not surprising, right? I mean, if you have asthma and you're in housing, this comes into the whole discussion of underserved populations or vulnerable populations, right? Many times their homes might be closer to a highway area, right? And so you have nitrogen dioxide being emitted from those high traffic areas, and that's a pollutant that's very irritating for asthma patients. So I think the maps have an interesting opportunity as we kind of continue to evolve and record more data. So that's the initial thing. And then we have a real low entry point. There is a paid version for the app. And what we do there is we try to personalize and customize some of the features. Like if you want a favorite locations that you go to frequently. You can favorite those locations. I also put some notifications in there, so it prompts you to actually check your forecast periodic times of the day. Maybe you check your forecast in the morning, you check it at lunch, and you check it at 3 p.m. when your kid's going to be getting out of school and doing some after school activities, right? So there's some scheduled notifications in there. There's also a reporting mechanism where we can show, okay, here are the actual variables that were recorded when you recorded this symptom. And that's an area of opportunity where, over time, save it to a CSV file, save it to a PDF, and maybe take it to your doctor, right? I mean, here's just hey, I noticed this is identifying that I'm having problems with this particular allergen, or, that kind of thing. And I'd like to get tested for tree allergens because this is showing me that I might have a tree allergy, right? Or stuff like that. So there's a lot of opportunities, I think, to do that. Right now, from a visionary perspective, I think we're looking at, this Bluetooth enablement to the wearable devices. I want to be kind of universal. I want to be open. So as additional wearables emerge in the marketplace, I certainly am going to test out with a company that's out there right now doing it, but a lot of people are working on this technology and trying to expand the number of pollutants that are tracked by the individual wearable. And so that's kind of the next progression. And I think that most likely will be more of a premium version. I'm talking to my developer about looking at that and saying, maybe that's the version where we implement more AI, machine learning, IoT, Internet of Things, sensor connections and stuff like that. Because the idea is that, whatever is the closest available data source for your pollutants and allergens, that's what I want to pull from, right? So within the app, we're trying to build that technology into it.
That was going to be my next question around the tie-in with the wearables, which you've answered. But yes, there is the asthma and the well-known diagnosis, but those of us that may see that we are occasionally exposed to cold or other things, what are some of the key actions that can be taken to start to monitor from the results from the app and start asking, how do we then start asking questions, whether through our doctor? How does that conversation start, considering the existing healthcare system is more reactive as opposed to being proactive?
Yeah, and right, and you hit the nail on the head. I think that that's an uphill struggle to a certain extent, and it needs to be initiated by the patient. The patient's going to be the mover and driver here because they're the one actually experiencing it, right? So I'll give you an example. What's been interesting about the changes over the last several years is we see that extreme weather events are actually becoming more and more impactful. So there's three different areas where I would cite that. One is extreme heat, right? And so one of the reasons I pivoted the product from DailyBreath Allergies and Asthma to DailyBreath, the air you breathe in your health, was because the evidence over the last, I'd say, 5 years has been increasing for, okay, well, maybe it's not just respiratory health, maybe it's not just cardiovascular health, but how are pregnant women experiencing wildfire smoke? How are the elderly and children dealing with wildfire smoke? How is heat impacting these pollutants? And we talked about that a little bit earlier with how the risk index is calculated. And then the third is kind of extreme precipitation. One of the things I wrote recently about was, why are we surprised that areas on the East Coast are having higher levels of pollen when Helen came through the Southeast and dumped 32 inches of rain, right, in a very, very short period of time? Well, the plant growth with that type of saturation of the soil is probably massive this spring, and that's what caused the pollen intensity. So we see that extreme weather events, extreme precipitation events, we talked about the wildfire smoke, all of these extreme events are impacting broader populations. So that's where the topic might have been specific conditions, and those conditions are still the ones that are most impacted from a negative outcome perspective. Like, we'll talk a little bit about kind of the incidence and economics, right? I mean, the issue with asthma is, imagine if there are 30,000 asthma symptoms experienced in the US every day, right? The metrics are about 5,000 of those are incidences where people can't recover their breathing sufficiently with inhalers or whatever they're doing, that they have to go to the ER. Okay, so 1,000 ER visits every day in the US. And then of those, 1,000 of those lead to inpatient hospital stays, right? And then 10 people every day die of an asthma attack in the United States. So if you look at those metrics and look at the economics of ED visits and inpatient hospital stays and the costs of those stays, right? And think about it in terms of what would it take from an expenditure perspective, from a preventative point of view, to save $3,000 to $5,000 in each ER visit, let's say, for example, right? So that's where we have to look at it and realize for specific populations that have potentially serious impacts to an exposure, we have to do a better job of prevention. But for the larger population in general, we have to do a better job of tracking, their experience of symptom of exposures on a frequent basis. And I've been thinking about building this into the app. How many days have you been exposed to wildfire smoke? Because again, we don't know what the longer term impact of wildfire smoke is. If wildfire smoke is present for a week or 10 days or whatever, Los Angeles would be a perfect example of this. If it's around for 7 to 10 days and you're exposed to it, maybe we should be tracking that you're exposed to that because you're within the plume of smoke that's impactful. And over time, we would be able to look at that and go, well, wait a second, this person started developing asthma symptoms and then now has been diagnosed with asthma, which they didn't have before they were exposed to the wildfire smoke. So maybe those 10 days of exposure really must have impacted them, right? So that's where I think there's just going to be a lot more growth. There's a lot of research institutions that are, working on the research associated with these types of correlations that I call. But what's valuable is that we're also building this data on the back end. And I'm currently looking for, an academic medical research partner that I can actually share my database with of symptoms, and we can join in a partnership to really discover these correlations and bring greater and greater value both to the app, but more importantly, just through these findings, really share that information with the general public, and so that they appreciate that there's multiple ways that these particular pollutants are impacting you. And at the end of the day, I want to drive the interventions that help people on a daily basis. But if it informs the public as to motivation for them to take policy action or to move towards policy action, that's great. I mean, you want it to be supporting good policy action moving forward because of the threat.
A final question around what can the storytelling or the communication around these impacts of air quality, what are the climate change advocates missing? What can they learn from your discovery so people can relate to their personal life about the impact of climate change compared to a global warming?
Yeah, I mean, I think the challenge for me, and it's difficult because every day I pull Google articles, and I can literally, maybe every day, every other day, I can pull an article that talks about a 15-year-old or a 22-year-old or, a father, a 35-year-old father of two that dies of an asthma attack or, and so to me, it's like, this is a here and now problem. Okay. And it's a here and now problem that it's impacting people. It's impacting fathers, families, parents, tragically. And so it's like, yes, it's in the scheme of things, there's this number that puts out air pollution is going to threaten 7 million people annually, because of climate change or whatever you want to call it. Those to me, they're very esoteric numbers. It's like, that's just way up there in the clouds. And it's like, those numbers don't drive. What drives the action is those personal stories and understanding that there's a personal impact. The reason the young girl, the 15-year-old girl, is that she's not counted in the deaths, but her life was tragically impacted by an asthma attack. Her entire family was dramatically impacted when she had that asthma attack at 15, 7, 8 years ago. And ultimately, she died of that asthma attack in December of 2024. So it's these stories that I think we have to understand and associate with action now. I totally appreciate. I was just involved in something called the Exposo Moonshot Forum, where we're trying to document the human exposome, much the way the Human Genome Project ultimately documented a gene. And that accelerated a whole range of growth opportunities in health by mapping genes and being able to begin to figure out how do we address genetic disorders and things like that. Now we're trying to do the human exposome, and there's a goal of trying to map the entire human exposome by 2040. And that's great. But at the end of the day, don't let the perfect be the enemy of the good. Let's track what we can right now so we can stop negative impacts from occurring today.
Huge thank you to Eric. If listeners want to find more of your work, where can they find you and what's your final thought?
Yeah, www.dailybreath.com. And again, Daily Breath mobile app in the Apple App Store or Google Play. And, I just think, this is a time for action. Each of us is being impacted by our environment outdoors. And the goal here is for you to recognize that it's impacting you personally and take action by first being fully informed about the weather and the environment and how they do intersect with your body personally, right? And I think that will motivate you to take the action to do what's important for you for air quality in your home, indoors, and then potentially outdoors on very problematic days.
Great. Thank you so much, Eric.